Hello, so just doing this video for anyone that's pregnant, or it's also interesting to know for people that might be thinking of having a baby in the future, just regarding training. The best thing to think about when training when pregnant is what suits you, what feels right for you. That's the key thing in everything, because it says that you can do that and that's okay, doesn't necessarily mean that feels aligned for you. So the best thing to do is to listen to your body. Trimester 1, when you start, it's really normal to suddenly start to feel quite out of breath and find the workouts hard, like almost instantly. That's because generally in the early stages of pregnancy, your blood pressure drops, and when your blood pressure is lower, your heart rate is always higher. So when your heart rate is higher already, and then you start to do workouts, that can start to make you feel like you're more out of breath. Obviously as well, you have to take energy into account. You know, you might be feeling a little bit more lethargic and a bit less full of energy in the early stages of pregnancy. So just taking that into account when you come to do your workouts. Always, if possible, let myself or one of the other coaches know. I'm a pre and postnatal specialist, so you know, I'm always happy to advise and help, and I'm such a strong advocate for training in pregnancy. I've had so many ladies train with me, and it's like been so successful. And you know, if you ask any of them, they'll tell you that it was probably the best thing they ever did. Obviously other than having the baby, but I mean training while pregnant. So yeah, in the first trimester, things just to be kind to yourself. Know that you might find the workouts a little bit harder, you might find your energy's a little bit lower. So when you come in and you look at the workout, you know, instead of picking up the dumbbell that you normally pick up, you might just want to pick up one a little bit lower. Yeah, so just making that workout a little bit easier for you. Also being kind to yourself and thinking, do you know what? I ain't going to do 30 wall balls today, I'm going to do 25 or 20, and that's fine. Just being kind to yourself and just taking the workout down a tiny bit, the intensity out of it. Exercises to avoid in the first trimester, obviously the obvious things are anything like if it was icy outside, you wouldn't run because there's a chance of falling. You know, things that could injure you, that could make you fall. Not really anything that we do here other than, you know, if it was icy, and I'd say you shouldn't be running outside, but also is going for what feels good for you. Because your blood pressure's lower, you may find anything where you're going down to the floor and back up can be a little bit uncomfortable. So burpees might not work for you. Sometimes even slam balls might not, because obviously you've got that going up and down. So just be aware of that. Some ladies feel fine doing burpees in the early stages of pregnancy. Some might prefer to take it into a half burpee. Yeah, so with your hands and you're not popping your chest down to the floor. You just got to decide what works for you. Second trimester, you might find that your energy levels start to pick up a little bit, and you start to sort of feel a little bit more how you did pregnancy with your training, and from this point onwards, I would say to start avoiding any heavy core work. When I say heavy core work, we work your core when you do everything. So when you do kettlebell swings, when you're doing upper body stuff, your core is working. But I would say, you know, you're not going to be doing sit-ups now, things like planks. Obviously, I forgot to say this one as well. No handstands. I won't be doing handstands at all once you've found out you're pregnant. Obviously, the chance of falling. And also it's going to really work your core when you're doing a handstand. So second trimester, yeah, just starting to take it down a little bit. You might be starting to show, have a little bit of a bump. You're not going to be wanting to do burpees anymore, so going into the half burpees. The other option would be, need to get a step. I'm back. The other option would be for your burpees, you might just want to get a really low step, and that might work better for you. Yeah. And the same with doing press-ups. Instead of doing press-ups with your hands on the floor, you might just find doing press-ups with your hands on the step is going to work better for you. And again, it's just about being kind to yourself. You're not trying to change anything now. You're trying to maintain health, and maintain your fitness, and maintain a small amount of your strength, maintain your strength. This has got, you know, endless benefits, but also the fact that post-baby, you'll find that you recover a lot faster as well when you continue training in pregnancy. Workouts, obviously same, first trimester, you're not going to come in and try to crush a workout like you used to. You're not going to come in and try and lift as heavy as you ever have, or heavier than you've ever done before. However, go with what you feel. So I wouldn't be having you coming in and doing a 1 rep max deadlift, of course, but if you feel like you can lift a little bit more than you perhaps did in the first trimester and it feels okay and you're being safe when doing it, then absolutely go for it. As you move on into the 3rd trimester, obviously you're going to have more of a bump showing then. Some people, energy carries on going up. I know that people say that in the 3rd trimester their energy is low, but when I've trained ladies in the 3rd trimester, some of them have just felt even more lifted. I mean, Katie won't mind me saying, I remember in the 3rd trimester she turned into an absolute machine, and Rachel as well. Some of you will remember Rachel. She was training after a due date. She was she found her energy levels lifted. There's other girls that have been to the gym as well. I know that they won't mind speaking to you, Jodie and Lucy. So if anyone has got any questions, I'm sure they won't answer them if you're wanting it from someone who's been there, done that. So 3rd trimester, you're going to be wanting to sort of reduce the whole having to use your core a lot. So things like overhead presses might stop working for you as you're getting bigger, yeah? So you will find seated ones are going to work a lot better because it's just eliminating the use of that core. I have got some of those pregnancy balls, or I don't think they're actually called pregnancy balls, are they? But I think people call them that. They're the big Pilates balls that you can sit on. I haven't got them blown up at the moment, but I can blow them up. They're really good to sit on to do some light exercises like your shoulder press, if there's a shoulder press in the workout, because it just incorporates a bit of balance as well. And while you're sitting on the ball, you can be thinking about sort of drawing up through your pelvic floor as well. So your 3rd trimester, yeah, you're not going to be wanting to do anything that's really kind of overworking your lower back and overworking going upwards, because you're going to be working your core so too much. So obviously you probably want to take the weight down a bit. Things like dumbbell snatches are going to be better coming just from waist height instead of coming down from the floor. If you're doing things like deadlifts with the dumbbells, you might just find you're just going to go to like knee level as opposed to going all the way down to the floor. Just got to know what's going to work for you and what feels right for you. You know, I've had ladies before where lunges haven't felt good, so they need to just stop doing lunges, but squats have felt fine. So unfortunately, wall balls usually are the generic thing that you can do throughout pregnancy, so I'm sure you'll be really happy about that. Obviously in 3rd trimester, I mean, burpees are completely out the window, putting your hands onto the floor, but if you're feeling good to put them onto a step and do them still. Some people just really don't like it, but if you're feeling obviously on a higher step, then you can go with that. So if there is ever a workout from 2nd trimester and 3rd trimester where there's a core exercise, I would recommend, obviously speak to one of the coaches, but you can also decide yourself if you want to, swapping the exercise for a lower or a upper body exercise instead of a core exercise, or using that time for doing the core exercise, but something that's going to really benefit you by doing I need to sit on the floor for this, doing your pelvic floor. So everyone else might be doing sit-ups, you can sit, and I just want you to let one knee drop out to the side, and at the same time you're going to try and squeeze your pelvic floor. Yeah? 2nd and 3rd trimester, if it doesn't feel right, don't lie down on your back. Everyone, I know that they recommend, when they change the recommendations all the time, don't they, to say to not lie on your back and then tell you that you do. The training I've had was not to spend long periods of time lying down on your back, so I would recommend just sort of leaning back slightly. Pull up through your pelvic floor, let your knee drop out to the side. Yeah, all the time. You'll know when you're doing it right, because you can feel that as your knee drops to the side, it's really quite hard to keep that pelvic floor engaged. So that would be for swapping for core exercises, upper, lower, or doing a pelvic floor exercise. I hope this has helped. Just a really quick recap. 1st trimester, go with what feels right. Be kind to yourself throughout pregnancy, but especially in that 1st trimester. You're going to feel really out of breath. You're going to feel really like you suddenly just dropped your fitness, and it's going to feel like it's happened overnight. It hasn't. Your heart rate's higher. Your body is now doing an amazing thing. It's creating a miracle. So just be kind to yourself. 2nd trimester, you might find your energy picks up a little bit, and you feel like you can just come in and probably do heavier weights, but you're not going to go with the intensity of the workout. 3rd trimester, whatever works for you. It's literally whatever works for you. Maintaining safety at all times, not overly working the core or doing anything that can make you fall over or anything that makes you feel uncomfortable, and just all the time when you are doing a workout, being aware, how does this feel for me? Doesn't matter what Victoria said, this is going to work. Does this feel all right for me? And that is the most important thing. Yeah, just because my training and my book said this is what you can do, doesn't necessarily mean that is what it is. You've got to absolutely just go with what feels right for you at all times. Obviously, please reach out if you've got any questions. I hope this has been helpful, and speak to you soon.